Dear students, we are in the third part of the topic epilepsy, continuing from the second part. So the pathophysiology is also related to role of cytokines. You know that cytokines are the kind of enzymes which are produced, whenever the body is, trying to fight severe infectious conditions. And at present, I can say that corona patients who are having corona, the novel coronavirus, that is a SARS-CoV-2 or COVID-19, is also the major cause of death is also due to increased production of cytokines. These cytokines are produced basically whenever the body fights to kill any antigen such as corona, any virus which is hurting our body. So, but at the same time, this inflammatory process uh, or the production of cytokines can injure our body itself. So those kind of conditions. Then here, when the cytokines levels are high and the high fever is there, the person may go for seizures. Two types. The second type is, first is already we discussed, simple and simple the type of this thing. Second is simple febrile seizures and complex. So in the febrile seizures, generalized, that is less than 15 minutes duration, and it does not recur within 24 hours. And complex prolonged seizures, usually more than one in a 24-hour period, or maybe focal, or sometimes based on a particular local area in the localized in the area of the brain, indicative of a more serious condition. So complex is indicative of a more complex condition. Simple febrile seizures normally when you control the condition, why the fever is there, and you extract, but it should be because of any extracranial condition, and when it is controlled, it is going to be normal. In febrile seizure recurrence, one third may have at least one recurrence. The younger the age of onset, the greater the risk of recurrence. Low fever at first seizure, and usually family history is very related. A risk of developing epilepsy, 2%, that is 1% in general population. That is normally one 2% of the 1% which is normally having febrile seizure. In that 1%, and if you take that group as a 100%, only 2% of that 100% will have a risk of developing epilepsy. So febrile seizures cannot, nobody, if somebody, children, kids who had febrile seizure, doesn't mean that only 2% of them will have epilepsy in future. Risk increases with complex and abnormal neurological states. Investigation of febrile seizures. Lab investigation, although routine, usually unhelpful in the evaluation of first-time seizure, possible just a sodium and glucose level. Although investigation to understand the level of electrolytes and the level of glucose. CT, that is computerized tomography, is not warranted in the evaluation of simple febrile convulsions, but considered for complex, because complex, as we already discussed, it may happen more than one time during 24 hours of time, in a 24-hour duration. So that is due to a serious condition. So condition has to be understood, diagnosed. Routine EEG, electroencephalograph, ECG, and EEG is seldom necessary. Lumbar puncture, maybe it's a questionable to study the CSF if at all the infection is because of condition relating to the CNS infection, that is meningitis or those kind of condition. Simple febrile seizure probably not indicated. So LP, that is lumbar puncture is not at all indicated. No need to do lumbar puncture, or CSF study is not needed in a simple febrile. Only in complicated febrile we have to think about other serious conditions. Uh, probably those with prolonged postictal phase. Postictal phase means just after the ictal is the epileptic syndrome phase. So after the seizure phase is called as post-ictal phase. So this phase also, it is very necessary to conduct investigative test to understand the stability of the patient. Treatment for fibrosis. See, basically all treatment is, as I already told you, oxygenation, circulation, glucose, supportive care, everything has to be given and electrolyte support. But along with that, medication will be given. And here, only difference in febrile is along with the normal. Here, antipyretics to reduce fever has to be given. Once you reduce fever, this febrile seizure will also go. So that's why people olden days people will say used to put cotton cloth on the forehead, dip it in the water and put it on the forehead. Only reason is to it is we cannot control the condition. Only idea is to not allow febrile seizure due to high fever. So high fever should be controlled, otherwise it is going to lead to seizures. And counseling of the parents are very important to take care of these kids. So teaching, educating the children who may are susceptible for febrile seizures are very important. So now coming to the treatment of epilepsy, drug treatment should be regular. Some of the points to remember is drug treatment should be regular, simple as possible. Treatment route should be very simple. Minimums or side effect, other minimum side effect. We cannot give a medication with huge side effect because this is going to take for the treatment is going to take for years. Years of treatment is necessary to control epilepsy. Monotherapy means you should try to use a simple same drug. Don't try to combination drugs and all complicate. It may complicate the situation because the child will be dependent on more on the combination therapy and huge doses. So reducing the dose is very important. Initial high doses increases side effects. So high dosage is rarely given by doctors unless the dose is not sufficient to prevent epileptic seizures. Episodes has to be reduced. Rapid withdrawal carries the risk of provoking. So suddenly stopping medication, again the seizures or epileptic syndromes may happen. Always calculate the dosage according to the weight of the child. So dosage is calculated according to the weight of the child. Treatment for epilepsy using all these medications, normal medication, olden day medication, continuously even now also given is carbamazepine, sodium valproate, clonazepam, phenobarbital, phenytoin. See, all these drugs are also most of the drugs I have quoted is also drug for psychiatric problem also. The newer drugs given for epilepsy is clobazam, oxcarbazepine, carbapenem, vigabatrin, lamotrigine. So there is a condition called as the epileptic syndrome starts and it does not stop, and it continues, goes on continuing, and it may continue until a treatment proper treatment, very good specialist treatment in the casualty is not given. So this is a condition status epileptic means this epilepsy syndrome without it's continuing, the seizure continues without any stop until a medical treatment is given. So this is called a status epilepticus, and it is highly fatal. The child or the person who has goes for status epilepticus may die. So it may present in multitude of forms, depends upon the etiology and the age of the patient. It may show myoclonic, tonic, subtle, tonic, clonic, absence, complex partial, any kind. But the only thing is, whatever is the type of seizure, it is sustaining. So this kind of seizure, very fatal, has to be taken care of very immediately. Generalized tonic-clonic SC, that is GCSE, is the most common form of status epilepticus. So generalized tonic-clonic, the normally seen tonic-clonic SC status epilepticus is commonly form of status epilepticus, which has to be controlled very immediately. So status epilepticus single seizure more than 30 minutes. Seizures, a series of seizures, 30 minutes without full recovery, again 30 minutes of seizure without a small break, again seizure. So it's going to be very fatal if not controlled. The longer the SC persists, what will happen? The lower is the likelihood of spontaneous cessation. Harder it is to control. The higher is the risk of morbidity, and more. Even if you save the person, morbidity is there. More if mortality happens, it happens. If you save also, the whole condition, the neurological status may be gone, reversed, and all whatever physiotherapy we have done to improve the other conditions totally will regress. Typical seizure duration, normal seizure duration for normal. So we are not talking about status epilepticus here. We are talking about the typical seizure duration. For children less than 5 years, it will be more than 5 minutes. Younger children and infants, the data says 10 to 15 minutes. So causes for status epilepticus are 36% is fever, 20% medication change. Suddenly change the medication, the new medication is not acting, is not responding, so that will go up, so trigger the discharge. Unknown cause 9%, metabolic 8%, congenital 7%, anoxic 5%, all others including trauma, vascular infection, tumor, drug related is 15%. So fever, medication change, unknown causes, metabolic causes, congenital, anoxic, trauma, vascular infection, tumor, and other related, not the epileptic drug. Other drug related, drug given for other causes may also trigger status epilepticus. Mortality for adults, see 22% who goes for status epilepticus, almost 25% people will die. In children, it is comparatively less death rate, 15%. The primary determinant of mortality and morbidity of status epilepticus in children is its etiology. The cause is a reason for death, with the highest mortality rates caused by acute neurological condition, infection, trauma, stroke. These three things cause for stroke. So that's why we normally a stroke happens to somebody, and then there is a seizure accompanied by after this followed by a stroke. Is there is a very high chance of death. Prolonged seizure, temporary systemic changes, life-threatening systemic changes. So the time goes on, the person may die. Respiratory problems. What are the hypoxia and hypercarbia, increased carbon dioxide and decreased oxygenation intake? What will happen? Chest rigidity for muscle spasm, hypermetabolism, oxygen consumption is reduced, carbon dioxide production is increased, poor handling of secretion, neurogenic pulmonary edema will happen. Hypoxia, as you know, anoxia markedly increases the risk of mortality. Seizures without hypoxia are much less dangerous. So, along with the seizures in status epilepticus or in the complex partial area type of, then again, oxygen hypoxia also happens, mortality will increase. Acidosis of the blood acidosis will happen, and respiratory acidosis will happen. Respiratory acidosis, increased lactic acid production. Naturally, there is fatigue of the muscles and increased impaired tissue oxygenation, increased energy expenditure due to seizure related movements. So normally, what will happen? Systemic, status epilepticus will increase. The glucose level is also related to the hypoxia. So whenever there is a decreased hypoxia is happening, the glucose level, see here, it is normal, and when the seizure time increases, see here, the seizure is starting, the glucose level is good, normal, up to some time, 30 minutes it is going to be stable, the normal glucose level and the oxygen level is going to be stable. But after 30 minutes, what will happen? The patient's glucose level, see, it's coming to almost nil, and hypoxia. So this will lead to death and neuronal damage and death. Hyperpyrexia, increased temperature, may develop during protracted status epilepticus, which impairs substrate delivery while increasing metabolic demand. Treat hyperpyrexia aggressively. There is no time to think about any treatment. Treatment has to be given as soon as possible. Hyperpyrexia, antipyretic, you like paracetamol or any higher dose of paracetamol can be given. External cooling, the whole body has to be put into. Sometimes they will immerse the person into ice water, and just to, not the head, all the body except the head will be put into the ice water so that the temperature is reduced drastically. So 3 ABC to remember for the treatment is oxygen, oral airway, suctioning to clear the secretion, avoid hypoxia. In the A, oxygen, that is airway. Airway is oxygen, oral airway, that is intubation, suction to avoid secretion, avoid hypoxia. B. Big